Welcome to the third section of the cardiology, and in this section we are going to study about the disease in the cardiology. We will start from the cardiac arrhythmia, then we will proceed to the ischemic heart disease, inflammatory heart disease, congenital heart disease, and all the small topics related to the cardiology section. Now we will start with the cardiac arrhythmia. Speaking about arrhythmia, cardiac arrhythmia is the first misconception comes from the literal word, that is arrhythmia. Means suppose that if anybody asks about the what is arrhythmia, then most of the people usually used to say that abnormality in the rhythm is called as cardiac arrhythmia. But usually the cardiac arrhythmia is said to be the alteration in either rate or rhythm of the cardiac contraction. The abnormality in rate or rhythm in the cardiac contraction, contractility of the heart is called as the cardiac arrhythmia. Now, before going to the classification of the cardiac arrhythmia, we should know that how is the conduction system working in the cardiac region. So the conduction system starts from the SA node, which is the pacemaker of the heart, and the conduction reaches to the AV node, and then AV node from AV node it goes to the bundle of His, and bundle of His divides the conduction system into two parts, that is left bundle branch block, left bundle branch, and right bundle branch. And from left and right bundle branch usually Purkinje fiber originates and distribute to the ventricular region. So this is the sequence of the conduction system. While during the classification of the cardiac arrhythmia, usually it is divided into according to the formation of the impulse or conduction, formation defect, or it can be due to the conduction problem. So formation defect may be according to the site. Suppose that the defect is in SA node or sinus region, then what type of arrhythmia can be produced? It can be sinus, it can be sinus tachycardia, sinus bradycardia, or sinus arrhythmia. We will study each of them. Arrhythmia, it can be tachycardia, it can be bradycardia. Okay. Now after SA node it goes to the atria. Means SA node the conduction goes via the atria to the AV node. So what will be the abnormality in the formation via atrium? Atria का क्या problem हो सकता है? There can be atrial fibrillation, flutter, or PSVT, known as paroxysmal supraventricular tachycardia. Atrial fibrillation, it can be atrial flutter. PSVT means paroxysmal supraventricular tachycardia. And some of the premature contraction also causes formation defect via the atria. Then suppose that the conduction we reached to the AV node, and usually the conductional formational defect from the AV node is usually indicated by or written by the word junction. So the junctional, what will be the defect called as junctional ectopic. Suppose that any ectopic is the impulse formation other than the SA node. Usually the SA node is called as the pacemaker of the heart, and if the impulse formation always starts from the SA node, the impulse formation other than the SA node site is called as ectopic. So junctional means AV node is acting as the pacemaker of the heart, then that will be called as junctional ectopic, junctional rhythm. It can be junctional tachycardia. So in this way we divided. Now disturbance in the ventricle via the AV node. Finally the conduction reaches to the ventricle. And what will be the ventricular defect in the formation context? It can be, there can be ectopic, there can be tachycardia or fibrillation, or ventricular fibrillation can also be there. So these were the formational defect in the arrhythmia classification. Now coming to the conductional problem, conductional defect. So what could be the conductional defect? Again we will start from the SA node. SA node में क्या हो सकता है? There can be SA node blockage called as sinoatrial block, AV block. AV node में भी blockage. We will study about the AV block. AV block is divided into three types: first degree, second degree, and third degree. Third degree is also called as complete heart block, and second degree is divided into Mobius type 1 and Mobius type 2. Mobius type 1 heart block and Mobius type 2 type of heart block. So and finally if it reaches to the bundle of his, then bundle branch block can also be seen in this condition. Bundle branch. So what were the types of the bundle? It can be either left bundle branch block, left bundle branch block, or it can be right bundle branch block. So this is about the classification. Now we need to study about the each of them by making a special single topic. So one should know that what are the supraventricular tachycardia. Supraventricular means above the above these conditions. All the arrhythmia which causes tachycardia can be included as a supraventricular tachycardia. Look, it can include either these, most importantly, these are the supraventricular tachycardia, which the ectopics or the arrhythmia which originates from the atrium is considered as the supraventricular tachycardia. Okay, means all the tachycardic arrhythmia which is situated above the ventricular region is considered in the supraventricular tachycardia. And as we knew that the ectopic is the origin of the whenever the origin of the impulse is other than from the SA node, it is called as ectopic. So this was an important topic, ectopic. And this ectopic can be either supraventricular and ventricular. It is divided into supraventricular as well as ventricular. Means supraventricular are these are the conditions, and ventricular में ये हो गए आपका, and these are the blockage condition. Now we will study specifically about the some of these important topics. Like look, we will start from this sinus arrhythmia. There are few small MCQ points which one should know. What is sinus arrhythmia? Sinus arrhythmia मतलब क्या हो गया कि a person, whenever a person inspires, the heart rate is usually reduced. Inspiration के टाइम में obviously the heart rate is reduced, and expiration के टाइम में heart rate goes increased in a normal person. Okay, but if this is for the normal person, but in case of sinus arrhythmia patient, it is usually reversed. Means इंस्पिरेशन के टाइम में अगर हार्ट रेट इंक्रीज हो गया और एक्सप्रेशन के टाइम में अगर डिक्रीज हो गया, तो दैट इज कॉल्ड एज साइनस एरिथमिया. सो वन शुड रिमेंबर दिस. नाउ साइनस टेकिकार्डिया मीन्स व्हाट? साइनस टेकिकार्डिया मतलब हुआ कि a person's heart rate is more than 100 times per minute, but the ECG finding, if the ECG finding is normal, means the P wave, QRS complex and other intervals, PR interval and QT interval all are normal, in such a condition it is called as sinus tachycardia. Means normal ECG but there is tachycardia, then it is called as tachycardic. Sinus tachycardia, in the same way, for the bradycardia, sinus bradycardia, the heart rate is less than 60, but the ECG finding is normal. So this sinus arrhythmia, the arrhythmia originating from the sinus or SA node is completed. Now we will start from the arrhythmia which starts from the atria region. Okay, the arrhythmia which starts from the atrium is first of all we are going to study about the atrial fibrillation. Okay, and what does this mean? This is the arrhythmia in which the atria is disorganized and the multiple atrial foci are present in the atria from which the cardiac impulse is generated, and the heart rate is usually at the rate of 350 to 600 beat per minute. So starting from the atrial fibrillation. Okay, as we knew that this is a type of arrhythmia in which the atria has a multiple foci. Usually the atria has a single foci that is called as sinus SA node from which the impulse would be originated, but there is multiple foci for the origin of impulse. Okay, impulse का origin multiple foci से होता है, जिसके कारण क्या हो गया कि the heart rate becomes more than 350 to 600 per minute. Okay, this is the rate of the heart rate, and because there are multiple foci in the atrium, so the atria do not undergoes complete contraction. These are the general definition feature. Okay, atria do not undergo contraction, but only fibrillation is present, not contraction is. एट्रिया में कॉन्ट्रैक्शन नहीं होगा लेकिन fibrillation होता है. And what are the types of atrial fibrillation? Usually it is divided into paroxysmal हो गया एक, the other is the persistent, and the last one is the permanent type of atrial fibrillation. Paroxysmal क्यों कहा गया है? Because it usually originates and terminates without any intervention within 7 days. 7 days में अपने से आके ठीक भी हो जाता है, तो that is called as paroxysmal type of atrial fibrillation. Persistent होने के लिए if it lasts more than 7 days, then that is called as persistent, and usually it requires intervention, that is cardioversion is usually required. Cardioversion के बारे में हम लोग बाद में पढ़ेंगे. So it requires intervention persistent type में. अब permanent में क्या होगा कि even though the intervention is done, the arrhythmia is permanent. मीन्स कार्डियोवर्जन से अगर ठीक हो जाता है तो persistent कहा जाएगा, and if intervention or cardioversion do not work, cardioversion not working, then that is called as permanent type. और होता क्या है कि as we found that there were multiple foci which were originating. पैथोजेनेसिस के बारे में अगर बात करें तो पैथोजेनेसिस कहते हैं कि एट्रिया में क्या हो गया कि मल्टीपल फोकाई से इम्पल्स बनने लगा, जिसके कारण कि एट्रिया डू नॉट अंडरगो कंप्लीट कॉन्ट्रैक्शन, एंड दिस लैक ऑफ कॉन्ट्रैक्शन का रीजन हमेशा पूछा जाता है एग्जामिनेशन में. लैक ऑफ कॉन्ट्रैक्शन इन द एट्रियम, व्हाट इज द रीजन बिहाइंड दिस? यूजुअली द रीजन इज मतलब कि व्हाट आर द कॉन्सिक्वेंसेस ऑफ लैक ऑफ कॉन्ट्रैक्शन। अब इसी के कारण हम लोगों को एरिथमिया का फीचर आता है। जैसे कि अब क्या हो गया कि लेफ्ट एट्रियम में ब्लड का स्टेसिस हो जाएगा। अब इसके कारण क्या हो गया कि ए वेव में जेवीपी, डिसअपियरेंस ऑफ द ए वेव इन जेवीपी, दीज आर द कॉन्सिक्वेंसेज ऑफ द लैक ऑफ एट्रियल, लैक ऑफ कॉन्ट्रैक्शन। एट्रियल कॉन्ट्रैक्शन नहीं होने के कारण क्या हो गया कि ए वेव एब्सेंट, स्टैग्नेशन ऑफ ब्लड, कॉन्ट्रैक्शन ही नहीं हो रहा है तो एक्यूमुलेट होने लगेगा। डिसअपियरेंस ऑफ फोर्थ हॉट साउंड, एब्सेंट फोर्थ हॉट साउंड, ओके, एंड these are the feature, okay, and what will be the risk factor? रिस्क फैक्टर के लिए एक स्कोरिंग दिया गया है। what are the risk for the atrial fibrillation? then there is a mnemonics chats VASC, VASC, okay, and what is this? Usually C is for congestive heart failure, you can remember CHF, other is the hypertension, A is for age more than 75 years, and D is for diabetes mellitus, and S is for the sex, that is usually S is for the stroke history, okay. If there is a stroke, previous stroke history, then it is considered in the S. Chats VAS, and the V is for the vascular disease, any vascular disease present or not. A again comes, that is age more than 65 but less than 74 years, okay, this is 75 years old, A. And then another last A, S is for the sex, that is usually female dominant, okay. And why is this 2 written? Because if the age is more than 75 years, then a score is given as 2, and if the person has previous history of a stroke, then he gets a score of 2, and remaining all the features, all the characters have single score. So why is this scoring done? Because suppose that a person has gets a score more than 2, then usually warfarin should be recommended to him. warfarin अब उनको देना ही पड़ता है. So this is the prognosis ठीक होने के लिए. And look, and more than, if the score is more than 9 से अगर ज़्यादा हो गया तो आपका स्ट्रोक रेट जो है, स्ट्रोक का चांस गेट्स increased more than 15%, 15.2% हो जाता है स्ट्रोक का चांस. So this is the this scoring shows you about the what could be the prognosis of your disease. So this is about the atrial fibrillation. Definition में आपको पता चल गया कि multiple foci from the multiple foci are originated from the atrium, which gives origin of the impulse, and as a result the heart rate becomes 350 से it can be 600. Atria do not undergoes contraction but it undergoes fibrillation, जिसके कारण there were lots of feature like stagnation of the blood, A wave absent, fourth hot sound was absent, and there were 3 types of atrial fibrillation: paroxysmal, persistent, and permanent. Now coming to the sign and symptoms of the atrial fibrillation. Okay, what are the sign and symptoms? Usually this patient presents with palpitation. Usually they are asymptomatic, but they can present with palpitation, fatigue, syncope, angina, and cardiac failure along with thromboembolism. And the important sign that are present in this patient is irregular type of pulse, varying volume pulse. These signs are very important for the atrial fibrillation. irregular pulse. Okay, and volume is not fixed, means it can be either hypovolumic or hypervolumic pulse. Pulse deficit means heart rate minus pulse rate. Pulse deficit is present, and the other will be varying intensity of the heart sound. Heart sound का भी intensity vary करता है, और absent, as we saw that there is absence of A wave in JVP. Fourth heart sound absent, fourth heart sound, and there can be hypotension. Okay, now a very specific ECG finding. What are the ECG finding in this patient? Usually the wave and the rhythm is irregular. Obviously what we saw in this sign, irregular wave is seen. P wave is absent. Okay, because the atria is not undergoing contraction, only fibrillation is being seen in the atrial fibrillation. And the heart rate, when calculated the heart rate, we will find that there is 350 to 60 per minute, and that is the only fine atrial, but the lower rate fibrillary atrial fibrillation is also seen. And if we will talk about the differential diagnosis, it can be either it is difficult to the DD can be one can be confused with the atrial flutter, atrial tachycardia, and multifocal atrial tachycardia. It can be MAT, multifocal atrial tachycardia, atrial flutter, and atrial tachycardia with variable block can be there. Atrial tachycardia with some blockage. So these are the differential diagnosis, and some of the complication usually seen in the atrial fibrillation will be like syncope, thromboembolism, there can be cardiac failure, angina, and hypotension. Hypotension can be there. So now coming to the treatment modality, and what will be our goal for the treatment. First of all, our goal will be for the hemodynamic stabilization. And how we will perform that hemodynamic stabilization? Look, hemodynamic stabilization is done according to the state of the condition of the patient. If the patient is severe, is in severe case, then DC cardioversion is done. Severe case में cardioversion करना पड़ेगा, cardioversion. And if the patient is moderate to moderately severe, then we will perform drug substitute or drug medical therapy is usually performed. And the medical treatment is usually divided into two types, that is to decrease ventricular to decrease the AV load, atrioventricular load, by giving look, atrioventricular load can be decreased by mnemonics A, B, C. Means some of the drugs like beta blocker, calcium channel blocker, and adenosine. These can decrease the atrioventricular load, and we can also give them anti-arrhythmic drug. Arrhythmic drug for the hemodynamic stabilization. Okay, you should remember this was our first goal. Then the next goal is to control the ventricular rate. Control, as we decreased AV load, the same drug can be used to control the A, B, C, D. D is for the digoxin. Ventricular control ventricular rate. The ventricular rate can be controlled by the same drug, that is adenosine, beta blocker, calcium channel blocker, and digoxin. Okay, the next goal. And what are the antiarrhythmic drug? Usually the antiarrhythmic drug is sodium channel blocker and potassium channel blocker, that is flecainide, quinidine, amiodarone. Flecainide is the sodium channel blocker. So it can be remembered as QAF, cough, quinidine, amiodarone, and flecainide. Quinidine can be given, amiodarone, or flecainide. And these drugs are applicable in almost all the arrhythmic condition. So we can remember, we will remember all these drugs in this atrial fibrillation and repeat the same treatment in the atrial flutter and other types of arrhythmia. Flecainide. Okay, these are the antiarrhythmic drug. Now the next goal should be restoration of the sinus arrhythmia. And how is restoration done? Restoration of sinus state. मतलब कि नॉर्मल स्टेट लाने के लिए क्या किया जाएगा? वी विल परफॉर्म कार्डियोवर्जन. कार्डियोवर्जन में भी आपको देयर आर टू टाइप्स ऑफ कार्डियोवर्जन. Cardiovascular can be means restoration of the sinus rhythm can be done by electrical cardioversion or pharmacological cardioversion. Electrical or pharmacological cardioversion. So these are the method for the restoration of the sinus rhythm. And our next target is to prevent the thromboembolic complication. Prevent thromboembolism. So what we will give, as we saw in the chats VASC scoring, we give anticoagulant drug like aspirin and warfarin. First of all, the warfarin is given, and if the patient is resistant or any contraindication is present for the warfarin, then usually aspirin or newer drug like aspirin alternative can be given. Embolism prevention is done via warfarin or aspirin. So what were the goals? And usually we should find out the underlying cause also. That is also our goal. Find the underlying cause behind the cause. Okay, so the goals of the treatment for the atrial fibrillation is to hemodynamic stabilization, the first goal. And according to the severity of the patient, if he is severe, DC cardioversion, and if he is moderately severe, then we can give medical therapy by decreasing the AV load and antiarrhythmic drug. Then we control the ventricular rate via the adenosine beta blocker and calcium channel blocker and digoxin. Restoration of the sinus rhythm is done via two methods. Either it can be electrical or pharmacological restoration, that is cardioversion. And prevention of the for the thromboembolism का prevention के लिए we can give warfarin or aspirin. And we need to find out the underlying disease, and then we should treat that. And in some cases use pacemaker, anti-tachycardic pacemaker, or can also be in refractory cases anti-tachycardic pacemaker is also used. Anti-tachycardic pacemaker is also used in as a newer modality of the treatment. Okay, now as we studied that the during the classification of the arrhythmia, we studied that ectopics can be divided into supraventricular and ventricular. So what are the cause behind the supraventricular tachycardia? So one should know that the supraventricular tachycardia, in which all the atrial fibrillation, all the atrial flutter, paroxysmal supraventricular tachycardia, these all are included in the supraventricular. Okay, and what are the causes behind the supraventricular? This means atrial fibrillation or flutters. All the causes for the supraventricular tachycardia can be divided into can be included into the causes can be remembered as, and the most important cause is the idiopathic, and the other causes like coffee, tea, tobacco. It can be due to the ischemic heart disease. It can be due to valvular heart disease. Anxiety can also precipitate supraventricular tachycardia. Okay, these are the normal, usually most common cause for the supraventricular tachycardia. Okay, supraventricular and ventricular का अगर cause के बारे में बात किया जाए तो usually the same cause is seen in the ventricular cause also, but some of the drug ventricular tachycardia is same as above, plus drugs like digitalis, and some of the electrolyte imbalance like decreased potassium, hypokalemia can also cause ventricular tachycardia. So these are the cause for the supraventricular tachycardia and ventricular tachycardia. And we saw that the treatment modality and other finding of the atrial fibrillation. We knew that the atrial fibrillation में क्या होता है कि there are multiple foci for the impulse generation. As a result, the heart rate increases, but the atria do not undergoes contraction. As a result, the A wave in the JVP is absent, and even the fourth Hort sound is absent. P wave is also absent in the atrial fibrillation. Now speaking about the atrial flutters. Atrial flutter is exactly similar to the atrial fibrillation, and we will only talk about the slight difference between the difference point in the atrial flutters. Okay, one should remember that atrial fibrillation was irregular type, but the flutter is regularly irregular. So what does this mean? Usually the regularly irregular means, suppose that during examination in the ECG there can be, it can be regular, it can be irregular also, that is not fixed, but the irregularity or regularity can be seen in the ECG as, suppose that there were 2 P waves for 1 QRS complex, and that is called as 2:1 ratio. Okay, there can be 3 P waves for 1 QRS complex, then this is called as 3:1 ratio. Means either 2:1 or 3:1 or 4, even 4:1 ratio is also found in the atrial flutters. So and the heart rate is, this is will be 4:1 ratio. Okay, any of them can be seen in the atrial flutter, and the heart rate is usually 250 to 350, but in atrial fibrillation it was 350 to 600. As we saw that the cause behind the supraventricular tachycardia was ischemic heart disease, valvular disease, open heart surgery can also cause, and characteristic flutter shows sawtooth wave, F wave. Look, sawtooth means these are the small tooth and there is a big incisor between these small waves. Okay, so this waves, this appearance of the wave is called as the sawtooth appearance. Sawtooth appearance, and the wave in between the two teeth, two incisor is called as F wave. So these are the MCQ points. Sawtooth appearance is seen in which type of supraventricular tachycardia, or the next MCQ can be F waves are found in which disease. So now coming to the management is exactly similar to the treatment, and investigation will be similar to the atrial fibrillation, so we are not going to talk about this. Now coming to the next disease, that is paroxysmal supraventricular tachycardia, also known as PSVT. Okay, PSVT. So what is paroxysmal supraventricular tachycardia? Usually the heart rate is about 150 to 220. PSVT, paroxysmal supraventricular tachycardia. What is the heart rate? It is usually 140 to 220 beat per second. Okay, and it is paroxysmal and recurrent, so it is called as paroxysmal supraventricular. And the pathogenesis is usually re-entry via the accessory pathway. मीन्स यूजुअली द एस ए नोड से कहा जाता है कंडक्शन अपना ए भी नोड में जाना चाहिए था, बट देर इज री एंट्री वाया द एसेसरी पाथवे, सो दैट इज द री एंट्री इज सीन इन PSVT. Okay, this is the important point. Re-entry is the pathogenesis behind the PSVT, and as we know that the cause of the supraventricular tachycardia is similar. So now coming to the ECG finding of the PSVT. ECG में क्या दिखता है? PSVT अगर हो गया हो तो ECG से पहले how will they present? Usually they present with the palpitation, odd feeling of the chest pain, occasional lightheadedness, syncope लेके आ सकते हैं PSVT वाले भी, मतलब कि अभी तक सब कुछ सेम है. री एंट्री एक नया वर्ड मिला है आपको, and the heart rate is new, means 140 to 120, and the clinical feature is almost similar to the atrial fibrillation. and ECG finding में क्या होगा कि usually suppose that this was QRS complex, and then the P and the T waves are merged together and becomes tall T and P. There is merging of T and P wave seen in the ECG finding. Okay, and P wave is usually buried in the QRS complex before the QRS complex, and the other will be, there can be ST depression भी दिखता है. ST depression is also seen in this PSVT. And what will be the treatment modality? The treatment modality is slightly different. Okay, the vagal maneuver is also performed in the PSVT condition. Okay, and vagal maneuver कैसे किया जाएगा? Vagal maneuver is performed via the vagus massage, carotid sinus massage, Valsalva maneuver, gag reflex. Okay, these are the कैरोटिड साइनस का मसाज करके and the other will be Valsalva maneuver or gag reflex. So this will precipitate the vagus nerve stimulation and the maneuver delay conduction in the AV node in the patient with the circuit tachycardia. And suppose that if the person is unable to recover from the vagal maneuver, then we give anti-arrhythmic drug. Anti-arrhythmic drug दिया जाएगा, and what were they? They are QAF means quinidine, amiodarone, and flecainide. Okay, and along with anti-arrhythmic, we also have to decrease the AV load by giving ABC means beta blocker, calcium channel, and digoxin. And if even these medical treatment do not relieve the patient, then we undergo cardioversion. And a new modality of the treatment is radio frequency ablation. Okay, cardioversion के अलावा एक और मोडेलिटी, न्यूअर मोडेलिटी का ड्रग है, ट्रीटमेंट है कॉल्ड एज रेडियो फ्रीक्वेंसी एब्लेशन. Okay, this is all about the supraventricular tachycardia treatment. Means everything was similar except the re-entry and the heart rate and the ECG finding. And the treatment modality, first of all we will start from the vagal maneuver, then we will proceed to the anti-arrhythmic treatment of the atrial fibrillation and similar as atrial fibrillation and flutters. Now coming to the small topic, some of the small topics like Wolff-Parkinson-White syndrome. Wolff-Parkinson-White syndrome को कैसे पहचाना जाएगा ECG में? There is presence of the delta wave. And what are the what is the other presentation and the treatment modality? Look, first of all, Parkinsonism White syndrome. Okay, so what is the definition? Usually this is caused due to the abnormal band of atrial tissue. There is band of abnormal band. Okay, you should remember that this band is not normally present. Abnormal band of atrial tissue. This is atrial tissue which connects between the atrial tissue which connects the atria and ventricle. Abnormal band of atrial tissue connecting the atria and ventricle is and bypassing the AV node. Look, by passing AV node. AV node is bypassed and the atria and ventricle is connected by the abnormal band of the atrial tissue. This is called as the Wolff-Parkinsonism White syndrome. And delta wave. Now speaking or talking about the delta wave, usually the after Q wave, the after P wave, the QRS complex should be like this. Okay, but if this angle is lost, and in place of this, if a slight angulation is came like this, means oblique angulation is present before the ascending portion of the Q, then this wave is called as the delta wave, and the delta wave is seen in Wolff-Parkinsonism. Means this is the most important MCQ point related to the Wolff-Parkinsonism White syndrome. Delta wave is presence. Okay, and now what will be the complication are exactly similar to the atrial fibrillation, and the pathogenesis behind the whole Parkinsonism is also the re-entry via the accessory pathway. Okay, and the treatment modality is exact same way for the PSBT as we did like first of all vagal maneuver, and then anti-arrhythmic along with AV load decreaser. But the important point is the drug of choice for the whole Parkinsonism is the procanamide. Okay, this is the point, and in the treatment modality is similar to the PSBT. Now coming to the sick sinus syndrome, the another topic is small topic is sick sinus syndrome. And because this is a syndrome, it is constitute of a group of symptoms like it includes sinus bradycardia, sinus arrest, and combination of SA node block and AV block along with supraventricular tachycardia. Look what we have that: sinus bradycardia, sinus arrest plus SA node block, SA node plus AV node block, along with the supraventricular tachycardia. So this is the group of symptoms, means sinus bradycardia, sinus arrest with blockage of the SA and AV node along with the supraventricular tachycardia. This is the combination of a symptoms called as sick sinus syndrome, and it is defined as the abnormal cardiac impulse formation and abnormal propagation from the SA node, which prevents the penetrating